Good evening, everybody. We're on Finance Committee meeting tonight, or December 13th. So on the agenda tonight, we've got budget presentations from the library, the health department, and the water enterprise. And then at that point, once we wrap up, we'll talk about next meeting. There are no correspondence or liaison reports, and there are no meetings or meeting minutes to vote on this week. So with that, if we could start with the library, that'd be great.
Who wants?
Actually, yeah, you can already sit here.
Sit.
Yeah. I think it's already set up for that. Yeah, way ahead.
So we understand the marching orders tonight are to move it along quickly. All right, Scott?
Thorough but concise.
And I think you've all been here when we presented before, so we are still a 9-member elected board that runs the library. We hire a library director who meets the state requirements for library directors. We have a building that is now over 25 years old.
That's crazy.
It is crazy. We'll be 26 in a month here. And the building is actually a little older. And the building is a little, actually a little older than that, so. I think Deb will highlight some of the things that happened this year with the building, but we've been making the improvements that are needed, and it's gone pretty well for most of them. So with that, and we're only talking about maybe 1.5% of the budget here, you know, and we think we do more with our 1.5% than probably anybody else does in town to service the people in town, to provide services that they want voluntarily, you know. So with that, I will be quiet and go to
So just starting achievements, you can read them. I'm not going to reiterate everything. I will say we are proud of the grant we obtained. Writing a Library Services and Technology Act grant is a huge job, and we are hopeful. The funds came in early October. We've had a couple of programs, and we will be ramping up programming, including Abington Reads, in March. So we're excited about that. And then the other project for which we need to thank Scott and Andrew for their assistance is replacing the boiler. You will have noticed our publicity. The old boiler sadly decided that on Thanksgiving Day that it really needed to leave us, and it wasn't going to work for the last 4 days that we needed it. So it is what it is. But thank you both for the help on that. That was huge, and we appreciated it. And it is nice to have a warm library, not a cold one.
And we should mention that the roof project that we did just before that almost tripled the insulation of the roof. So that building stayed warmer than it would have if it had, you know, if the roof project hadn't been done. So we sort of bought a little cushion there.
Yeah. So you're saying we can go without a boiler more often?
No.
No.
Well, not for more than 4 days, and that would have been.
No. This Saturday after Thanksgiving at 8:05 a.m. when I was in the boiler room looking at the thermometer taped to the wall and trying to decide whether it was going to stay warm in there during the course of the day. No, that was not okay. It was 42. No, we don't want to do that again. Unless you want me to go over any of the other preliminary things, I will just move forward. Revenue, as I say every year, we are not a revenue generating department. There's not much there.
Those fines.
Yeah, the $88 in fines are likely fines that somebody from owed to another library and insisted on paying us. We try not to take them because we don't want to process them, but anyway. And then miscellaneous revenue would include faxing, which is still huge, and we are really the only place in town, only place convenient to fax. And people need to fax, especially medical things. Most, due to HIPAA, most medical establishments, doctors, hospitals, records cannot be sent as an email attachment. So if someone needs to send something to their doctor or to a hospital or to whomever, they have to fax it unless they want to drive it. And you know, that's, so a lot of that are fax fees, and then fees for photocopying and printing. So that is our revenue, and we're just going to move on unless you want to talk about it.
I'm just curious, what do we use for the fax? Because when those get scanned, we're not retaining anything, are we?
We have a circa 2000 12 fax machine, no, it doesn't do anything.
Okay, no, because when you mentioned HIPAA.
Yeah,
like,
no,
We don't
it-
want to be responsible for somebody's personal information.
No, it doesn't, it doesn't have that ability.
Okay.
We're lucky it can dial the phone.
Oh,
No, it doesn't.
okay.
And when we replace it, I will replace it with a bare bones fax machine that doesn't do anything for that purpose.
Okay.
The fewer bells and whistles on the fax, the better. It just needs to communicate. Okay, so moving right along to the budget. One of the things I want to highlight in the salary section is the reference librarian position. We've had a reference librarian, part-time reference librarian for over 20 years. The last 5 or 6 years, we've had quite a bit of turnover at that position. Position for this year was funded at 17.5 hours, and we would like to bump it ultimately to full-time, starting in small increments this year with taking it to 24.5. I'm mentioning this because that is definitely putting the position over 20 hours, which means eligible for benefits, and that's clearly a financial impact. There is also, though, a financial impact in hiring somebody, in going out and searching for them, in training them, and for this position, more than any other position really in the library, the amount of time for the public to become comfortable with them. Reference librarians work individually more than anybody else. This year, we're very happy. Our new reference librarian who started a year ago is wonderful, and he has been started this fall going to the senior center, and he's working with senior citizens there. People make appointments and come to see him individually. But building that rapport with people, especially with our elderly population, takes time. And if we continue the revolving door of reference librarians, what we're essentially doing is training someone, getting people used to them, and then ripping them away 6 months later. A professional reference librarian is a necessity. I think a full-time professional reference librarian would be ideal. I know it's going to take us a while to get there, but I feel like we really need to make the break from a part-time 17.5-hour-week position.
And the trustees feel that this would help reduce that turnover, that trend we've seen.
Yeah.
Help hold him and help hold anybody else that comes in that position.
We don't have, administratively, we don't have an assistant director. A lot of libraries locally our size do. I don't want more administration. I'm much happier with people who work with the public. And the reference librarian certainly does that, and I think that's the next logical place we need to go, and it's a need that is huge and growing. Reference librarian, in addition to providing tech help, still does actually old-fashioned research for people, helping. We had a patron recently who had a medical condition and they wanted a book because they didn't want to read stuff on a computer. And we were able to find current information, and that was some time consuming for him. So that is our primary focus right now. The increase in salary, the rest of the increase in salary is the union contract that was settled last spring. And I should also mention, I decided that this was kismet for this year because when I calculated a 3% increase, which is what the trustees asked me to do for the non-union positions, that took the reference librarian salary to $24.24. And the step 2 of the appropriate salary scale in the union contract, which is where one would expect this person would go if they were moving into the union, was $24.24. So I was kind of like, okay, we're going to go for it. So basically that's it. We have one library assistant position. It's a 14-hour-a-week non-union position that is vacant. We had 2 that were vacant at the beginning of the summer. We filled one. I've been using the money out of that position and filling it with other part-time people, filling in hours and stuff like that, and that seems to be working fairly well. And if that is the case down the road, we could possibly pull some of the money out of there, reassign it to some other part-timers, and maybe throw some of that at the reference position. So just a possibility.
Sorry, just a question about the library assistant position. Why are 2 of those managerial and 2 of them union?
Okay, so the library assistants, 2 are union and 1 is non-union, no.
Well,
it's-
yeah,
it's
by
just-
law, yeah.
Because everybody, the one that's not union is a 14-hour-a-week position, and the others are all over 20. So if you work more than 20
Okay,
hours.
so, yeah, okay.
The way the library union works, if
Gotcha.
you work more than 20 hours a week, you're in the union.
So the vacant one is also
Non-union.
non-union?
Yep.
Okay.
Yep.
Is the,
It,
oh, go ahead, Chris.
it looks like you've added at least a half a position every year for the last 3 or 4 years.
No.
No? All
No.
right. I'm just looking at the salary trend.
Yeah, we added the staff librarian in children's 2 years ago. And then there was confusion last year about the reference position during the budget process. When the budget was submitted last year, we did not have a reference librarian. And at some point, there was discussion that that was a new position, and it wasn't. It had actually been filled. Our reference librarian was very concerned in April because he was afraid he wasn't going to be funded. So no, we have not added, we really haven't added.
I see the budget from 23 to 24 went up to 45,000, almost 10%, over 10%.
Okay, so that's, where am I? So 403, a lot of that's the union contract. The union contract was, the union scales were very out of date. And when the contract was settled, the bottom 2 steps?
Yeah, we didn't.
We dropped the bottom 2 steps off the union scale and added steps at the top. So the union contract is expensive.
And
That's
that was a separate article,
at town meeting.
town meeting, but it's included in these numbers now.
Yeah. So that is the bulk of the salary difference. Some of it's the reference librarian and the bulk of it's the union contract. And again, the union contract needed desperately to be updated because, again, retention. The bottom scale of the professional steps was not competitive. In fact, it was really,
Insulting.
yes. So,
Do you feel like you're where you should be as far as staff headcount?
head count, if we had more hours for the reference librarian, yes, I do. Other than, I think we are. I feel like we're in a pretty good place. We cover our 53 and a half hours a week without too much difficulty. I feel like we're in a good place as far as numbers of people and as far as hours that people work, with the exception of the reference position. That's where I really see we are lacking. We could do so much more with more hours in that position in terms of providing services.
What it's hard to predict is how much more we're gonna recover from COVID. I mean, we're pretty much close to what we were before COVID and continuing to grow. Where will that volume growth go, as far as the number of people tracking through the amount of work and that may change the picture, but for the moment, I agree with Deb.
Okay. But
Your budget's 50% more than you were before COVID. The salary budget.
Yes, and there was a union contract settled in the COVID, it was right after you started, right? Yeah,
I think the first one was 2020,
yeah, I think so too,
and that was probably a retro one, because I think we were right
There was-
on the heels
yeah,
to do the next one.
yep.
Deb, why 24 and a half hours? Because like if you moved it up to 30, it's only a $6,000 difference. Just out of curiosity, why 24 and a half?
I'd take as many hours as I can get, quite frankly. I hit 24 and a half because I knew the union contract was there and that number is big and I didn't want to push too hard. I mean, I'd be happy to say 30 or 35. We could talk about that and just completely eliminate that vacant position too. I mean, I just,
I mean, it seems like you would get more value out of a reference librarian than another 14-hour library assistant.
that's why I haven't filled it. Yes.
So, I mean, why not taking half of that library assistant budget, remove it, and put the half into the reference librarian and bringing that person to 30 or 32?
Yeah.
I mean, like, if we're gonna use the library assistant that's unfilled, we're gonna use that money anyway, let's use it for a reference
Yeah.
librarian.
Good call.
If you're suggesting that,
I am suggesting that
Is-
officially, yes.
is quite
In whatever capacity
frankly
that is.
what the board and I had talked about, but we weren't sure that that would fly.
Maybe I'm a little bit biased because I know the value of a good reference librarian, I will admit that, but it stands to reason that if there's some money there from an unfilled position, removing that unfilled position and taking some of that, which would still be less than the total, and adding increased hours for the reference librarian seems to be a good use of those funds.
Better have the budget reflect reality.
Right,
Yeah.
right.
Yeah,
As
that's a
we
good
tried to
point.
do with police last year.
Yeah.
It's consistent with.
So I would recommend we move that to 30 hours and remove the library assistant.
I'd vote for that.
I personally leave it at 24 and a half and remove the. I'm cheap.
Why didn't you think that was gonna do it?
Quite frankly, because just the amount of money in the union increase and it just looked like a lot of money to me, and I wasn't sure whether a 14-hour-a-week position at $16 an hour is a lot cheaper than a reference librarian, and we just weren't sure what would fly and what wouldn't.
I think
It's
we
kinda hard.
should be more
I think-
concerned about needs than.
Yeah.
Yeah.
And I think to Marty's point, if we're already going above the full-time threshold where the person's eligible for benefits, then adding 6 extra hours isn't that much of a difference budget-wise.
Not appreciable,
So-
right?
And if it's a big difference for you and serving the
huge.
community, then that makes a lot of sense.
Yep. I can make that happen
And-
tomorrow
and
if
why-
Andrew will let me.
Why did you think it's too much of a jump if what they're saying is right?
Mostly because in the past, mostly before Scott was here, but in the past, when we've tried to add positions and we've tried to increase hours, it hasn't always gone well. And it's been very incremental. Well, you could do this, you could add a few hours here, and then you could add a few hours. And, I mean, this is going back 10, 12 years. I mean, not in the last 5 or 6 years. So I think I was being conservative.
Experience facing 25 years of finance committee members.
Yeah.
You know?
But I think, Henry, you touched on it earlier, it was like, it's 1.5% of the town budget. In what you provide, it's like, yeah, I agree with Marty. It's like, go for it.
Yeah, but just take out the assistant completely.
100%, use the
Yep.
assistant money to fund the reference librarian at a
But take
greater
it
rate.
out.
Yeah.
Don't
list the
don't
position.
manipulate it
Yeah,
at the
no,
end.
just
when you
move
don't
it.
use it.
Yeah,
Let's-
especially for the
let's
level
see.
of service you're offering.
Right.
Yeah.
Yeah.
We can eliminate that line completely and move it to the reference position. That's easy.
I think that sounds great.
I mean, that quite frankly will make me very happy because that really is what I wanted. I just didn't.
Well, we all like happy library directors.
Yeah.
Which
We
brings
like
up a
happy
question
department heads in
for
general.
Andrew and Scott. Are we going to get, I think last year you did this, a list of new positions and the dollar amount that's hitting the department and a guess
And-
at
Benefits.
the other financial effects, so that we can make those trade-offs if we have to at the end.
Especially for vacant positions. Especially if we have vacant positions that, and then some people are
Well,
trying to add.
and each
The new position.
Each department head will come in, and they do have listed, and not all of them have it, I think you're only gonna see it. The Department of Public Works would be looking for a couple of laborers, and then, obviously those costs will be in there. And the police department is a little ambitious.
But I mean, can
So
we-
you'll see-
You were meaning the overall, the
And
whole
overall, so that
budget.
we can see
like
it in
the-
one place.
Yeah.
Yeah, okay, thank you. That would be a big help, I think. For things like this, you can say, yeah, that,
Makes sense.
yeah, we know what that's getting.
And do we have any sort of guide that we follow, like if somebody goes from part-time to full-time, what the impact on the benefits is? They're like a little guide that we, like, if, what, because right now, because the retirement and the benefit and the insurance is in another bucket. It doesn't show up on the department budget.
Right.
We used to have a number, that used
Yeah,
to
we
be
had-
a dollar
we've
figure that
kind
if
of
you.
ballparked.
Yeah, like
Over the
this.
last
For
few
these.
years,
20%.
$5,000 or something.
Yeah.
20 for health insurance. Pensions kind of.
Yeah. Yeah, it could even be a percentage, whatever makes sense.
Right, yeah.
How much was health insurance?
Be about $20,000, 25 maybe.
Well, we only hire people that don't need insurance.
We try. That's the first question.
Why so many retired military?
All right, as far as expense lines.
Sorry.
You can.
Before you jump to expenses, just super quick question, is the custodian still split with the
Yes.
town hall?
Yep.
That was all.
Expense lines, again, I tried to be fairly conservative because I didn't want to be greedy.
What happened to heating? Did we move that? to
That
the
moved,
account?
yeah,
Okay.
that moved.
Consolidated.
Yep,
Okay, that's right,
consolidated.
okay.
That moved. So basically, the only, I'll highlight, the professional and technical is our OCLN assessment. So that's the network assessment, that's what makes us work. And happily, that only went up by 2%, 2.6% this year. And then the other big one is the books and magazines, which is library materials, all books, magazines, including Overdrive, Libby, ebooks, e-audio. And that needs to, for state requirements, that needs to be 15% of the total. And 15% of 624,164 is $96,324.60, which is where I got 96,325. Other than that, there's nothing. Again, as I said last year and say every year, the expense lines, I do my best, I figure it out, and then inevitably, money moves between them because we buy library cards one year, we don't buy them the next year, we buy more computer paper, however it works. But I don't think there's anything there that's really terribly surprising. We cut we've been doing, did it stay at 3? Building repair and maintenance, where is it? I lost. Oh, yeah. Building repair and maintenance, the trustees for the last 20 years, since the building opened, 25, have required that we submit that at a 3% increase. Due to the new roof and the new boiler, we cut it to 2% a 2% increase this year because we are not anticipating spending money on the roof.
And I should say, we asked for 3% a year because we started at a very low number because we had a brand-new building. It didn't require a lot of repairs and maintenance, so we've been trying to keep that line moving so that we maintain that building and keep it looking like it does,
So,
Didn't we have something for the roof?
Yeah, we redid.
yeah, we have a new roof.
All right,
Yeah.
there you go.
Yeah, so that was
I
one
thought
of-
you were saying you still need to do.
No, we have a new
Because
roof.
We reduced the maintenance budget.
Budget, yeah. We spent a lot on the roof prior to getting a new roof. And,
Spent a lot on the new roof, too.
yes, we spent a lot on the new roof, too.
Very,
A lot.
hopefully it's 50 years from now.
Yes. So the idea was we would not be spending money on the roof, at least for the next couple of years anyway. It's going to be under warranty, and we better not be spending money on it for a while. And we'll hopefully, there will still be repairs to the heating system, but we will clearly not be spending money on on boilers.
Just a curiosity question, with the boiler and the heating, does that affect the room that has the temperature, climate controlled for old?
The Wales room?
Yes.
It was cold in there, but it wasn't catastrophically cold when it was cold. And yes, keeping that room at an appropriate temperature is definitely a goal. You don't want a library cold.
And
So,
especially
yeah.
the one with the historical collection in it.
Yeah, yeah. And it was not, it was a short period of time, so no damage, but, you know, you don't want
No, I
it
was
to be
just
cold.
curious.
Very luckily, we had already started the project
Yeah.
when the boiler actually went out. We had folks on site
Yeah.
actually ready to move and.
Good timing.
Worked out good.
Yep, it worked. It was a little stressful, but it worked.
Andrew, can I ask, so with, the library's showing a $642,000 budget, about $3,700 in revenue. Are there any other offsets that we get to the library budget? No, okay.
We get state aid. That's not an offset. We use that for above and beyond. For example, this past year, we replaced the computers for the public. So the desktop computers for the public. So that came out of state aid.
Yeah.
We don't have, in the town, and we also picked up some new staff computers. And we had, the last time we got new chairs, we actually got them from the Old Colony Library Network. They were deaccessioning chairs. So we got free chairs from them that we've been using for the last several years. And we just bought new staff chairs because we had one that springs had come through and it was extraordinarily uncomfortable. So things like that. We don't have money in the budget to buy technology, computers, whatever. We don't have money in the budget for things like chairs and stuff like that. We use state aid for that. So that's not an offset, but it is money that the town, for things that we would clearly, I mean, we have to have chairs. It is money that the town would have to come up with if we didn't have state aid. Our first state aid payment was authorized at the Board of Library Commissioners meeting last week in the amount of $21,000 and change. And then in April, we should get another $21,000.
And is that fairly consistent year over year? Like some of that
This
is-
was a good year. The library community statewide advocated really hard for an increase in state aid to public libraries, and this was a good year. Last year, I think we got about 38. We do not spend it in the year we receive it. It just sits there and we spend it next year because,
And that history goes back over 40 years.
yes.
We haven't done that.
How much revenue do you guys bring in?
What is it, 3,800? Not much. We are not a revenue generating department.
3,600, 3,700?
Yep.
And, I mean, sorry,
Mm-hmm.
but is there any way to like increase that?
No, actually, we try to turn it away.
Why?
Because that's fines from other towns that still have fines.
The miscellaneous revenue is?
Well, we used to have fines.
We used to
Yeah.
have fines. And most towns have
And
done
now
away with it, but
they've
some of
done
the
away
towns in
with
Old
it.
Colony
Yeah.
haven't. So if you show up to turn a book into us, it comes up that you owe money. You have to,
Like, how many people come in there, different people come in there a year? Meaning, I'm losing the word, but how many people in a
Outside of
family? Four
Abington
people in a,
patrons.
Like outside of our network or whatever?
no, in the
No,
network.
total.
All right, so like, are you
Visitors
looking,
at-
are you looking for foot
Yeah, like come
traffic
in,
per year?
come in and take a book out,
Okay, hang on,
or whatever.
hang on, I can tell you. Let me find it.
I don't know why I can't think of the word.
Yeah,
Patron,
No.
patron visits.
yeah.
Patron visits,
Unique,
unique.
so one off.
One-off would be almost, we have a gate counter, so I can tell you the total number of library, people who visited the library. I cannot tell you the number of unique people because that would require IDing and profiling and is really kind of not
and the
legal.
5-year-old goes in and out a couple of times.
Let's,
No, I mean like somebody comes in and takes out a book. Right, so another person comes
We
in
can
and
tell you
takes
how
out a
many
book.
books, but I don't think we can tell you.
I
how
can't
many.
tell you unique, I can
We can't.
tell you, that's a program attendance. Hang on, it's here.
This is a report we have to get to the
The
state.
state,
every year.
yes. All right. Hang on.
You may be looking for this for my next question. You
Okay.
may want to throw the book at me, so.
Okay, what's your next question?
Can we charge people?
No,
Why?
it's illegal.
Is that legal? I don't know, I have a bad memory, but it's not legal.
It's a free
It's not legal?
public library.
No, but like for other
Free
things,
public library.
Just a quarter.
We charge,
I was thinking
we
like-
charge you if you want to use the copier.
like $10 a year.
We charge you if you want to use the copier, we charge you want to use the fax machine, but we are a free public library.
Yeah,
Except for the fax machine and the copier. So
Yeah,
can we figure out more stuff to go in
Those are
that
not-
bucket?
Those are not library
Library.
services, there are additional services we added on
Yeah.
top of the library.
Yeah, charging for library services to residents of Massachusetts is illegal.
Like really illegal?
Really illegal, yeah, like state law illegal.
Unless you're a
It's not
private
just
library.
borderline illegal.
Yeah, no, it's
I mean, Greg,
illegal.
if you really want to, we can probably like start a bar out back or
That's what I
something.
mean, like, if there were other services allowed.
We'll wheel a keg up on Saturday.
I think it does, yeah.
I say the same thing for the golf thing, like, let's
Alright.
get more.
More.
I mean, we are paying for it
I know,
Yeah.
but,
with our taxes.
Okay, so attendance in the library last year, 62,104. So 62, we had 62,104 visits. Now, that does not by any stretch of the imagination mean 62,104 unique human beings.
As Henry said, the 5-year-old running back and
Yeah.
forth.
Yeah, which is also, that we figure the 5-year-old running back and forth is countered by the time that the gate counter misses people, so I think it's fairly
And
accurate.
I imagine that affects state aid in some way.
Yes, yep, the better your numbers, all of these numbers, this
So,
is
so what you're saying is more 5-year-olds.
more 5-year-olds, yep. All of the numbers that you report to the state
People
help,
trying to get
and
their Fitbit steps in,
non-res-
just walk back and forth in front of the counter.
non-resident circulation helps, because we get state aid compensation for non-resident, for circulation to non-residents too. But it is in the Mass General laws, it is illegal to charge for library services. Sorry, Greg. There are libraries that have things that do generate revenue, they're bigger than we are, and.
That's more of what I'm
staff-
talking about.
Like, the Canton Library, for example, has a passport service.
yeah.
We don't have enough staff, and we don't have enough money to have staff trained. And that would, if we were to do something like passports, it would cost us. It wouldn't, we're too small. You have to accept the reality of your population. A library like Canton has that service, and they have around them, Canton, Milton, Stoughton, Millis, they have large populations around them. We are not going to generate enough money in passport revenue to justify the layout in doing passports, which is a massive training project. And then you also, if you do passports, you have an obligation to have the people who are trained to do it on site. It's like, we're open 53 and a half hours a week, so we would need to have a passport person. I don't think you need somebody in the evenings, but you would need, things like that are just not gonna.
You can't just train one person.
No, you can't just train one person, you need to train a whole bunch. So there are opportunities in bigger libraries to leverage those, but we can pretty much leverage faxing, printing, and copy.
And many of the people who use the library the most are the ones that could the least afford to.
It's the only place to get free Wi-Fi
Yeah.
and.
Or even just to
Job
borrow
searches
books. I
that
mean,
require-
you know, people that don't have an Amazon account or something.
Not to mention help with resumes and
Yes.
all of that other stuff.
Yeah.
Job hunting.
Try to look at it as services we provide for residents, help residents support the town by paying their taxes and, giving them the wherewithal to find jobs and things like that, and also to, that the library provides those services so that, to help people better their lives.
And those of us who were there when the library was first, the new library was first built and opened, know that every realtor in town drove their customers by and said, look at this service, which I'm sure they do at the high school now,
I'm sure.
Yeah, I'm sure they do.
All right, any other questions from the group?
No, I'd just like to state that Henry said 1.5%, it's less than 1% based on this year. If it's $642,000 budget, based on what we're looking at, it's less than 1% library budget to the town, so thanks for everything you do.
Thank you.
Absolutely.
Thank you.
Thank you very much.
And I will make that change that you folks suggested.
That's all Marty.
I may do it before I go home. Thank you.
Just hope they vote for it.
Yeah, I'll punch you.
And as we always offer, if anybody wants to come over,
Have a
see
cookie on
see
the
the
way
back
out,
room of the
please.
Thank
building,
you,
see
sir.
the, get the guided tour or whatever, we're always willing to host you, so just let us know.
Thank you.
Thank you, and thank you, Deb.
Thank you. Scott,
you,
I just
thank
want to
you.
say, I've always said that we could increase town meeting attendance if we served
hand out
cookies. Have I not,
You have.
years I've been saying.
Cookies,
Yeah,
chocolate,
no,
chocolates.
I don't even think they need to be warm.
What's that?
Chris New owns
Health
Guilty
department?
Bakeries from Abington.
Chris?
No, is that
Marriott.
them? Guilty?
There's one, I got one all the time.
How is that?
Always there, one of these warm, and they're actually delicious. Little hotel, sort of expecting, no, they like literally make them.
So thank you.
The bank used to do that.
Nice to
That's when my father used to go over there in those days to make a deposit and withdraw just so he could get his cookies.
Good evening.
How are you?
I'm doing well, how are you?
Good.
We get a little Starbucks in there?
I'm saying, when we got events over at Riley Field, whether it's high school stuff or like other stuff, have a little truck out there. Greg is all for new revenue streams.
Just keep making it.
All right. That was our group.
There and gone.
There, we can go back. All right, so that's our crazy group. So the health department's mission is to protect and preserve and promote the health and well-being of all Abington residents. We meet this mission through enforcement of health codes and regulations while promoting a healthy community. Our achievements. A lot of big things happened this year in the health department. We were able to hire our full-time health assistant, our full-time assistant health coordinator and the recycling education compliance officer. This allowed us to increase services within the health department and also start to initiate projects to reduce trash tonnage. We developed a community partnership with the MBTA and Operation Lifesaver. We had a staff member attend federally funded FEMA training down in Anniston, Alabama, becoming credentialed in environmental health training and emergency response. Staff spoke at local conferences regarding the partnership with the MBTA and the Operation Lifesaver. We also had staff be an exhibitor at a separate conference on the same topic, that community partnership. We have all of our staff fully trained as Red Cross BLS instructors, which allows us to begin offering a full complement of classes now the capacity allows for it. And then a staff member received a full scholarship for some training down in DC. 2 staff members received scholarships to go out to Cleveland for some continuing education.
I think you skipped
You
the
skipped
public health
one.
nurse award.
And then I was awarded
A staff member.
a staff member was awarded the Public Health Nurse Award at the MHOA conference this year.
Congratulations.
Thank you.
Isn't that the second reference we've had to Alabama in as many weeks?
It is.
It might be with
2
this
weeks
guy
in a
in
row.
the
Right? At a FEMA headquarters?
So it's Anderson.
Different reason,
Oh,
but second Alabama reference in 2 weeks.
Second one.
interesting. Related to FEMA?
No.
Oh. I was gonna say,
Betting on that.
Related to
Roll Tide, baby, roll
lawsuits.
Tide.
oh.
So,
So our goals for fiscal year '25 is we would like to see a reduction in trash tonnage as it relates to our other efforts to increase residents reusing versus disposing of items, recycling of items, using composting, and then seeing an overall reduction of waste. We have staff who have applied to speak at a national level at various conferences. We want to continue to offer safe and convenient vaccine accessibility, both at fixed locations and to homebound residents in Abington. Promote the welfare of our population, ensuring its security, protect from the spread of infectious disease and environmental hazards. We would like to continue to ensure local access to safe quality care and education to benefit our entire population. And we have one of our last goals is to increase training offerings to the community, such as Narcan training, CPR training, first aid, stop the bleed, food protection manager, emergency preparedness awareness level training, mental health first aid, which includes this QPR training. So revenue. For us, in fiscal year '23, our greatest revenue source came from vaccines and food permits. Historically, food permits and trash haulers have been the department's greatest revenue source. Going back, fiscal year '21 introduced vaccine billing into our revenue stream. We are able to bill private insurance, Medicaid, and Medicare Part B for vaccines listed on their fee schedule. It is Commonwealth Medicine we use as our biller. Fiscal year '22 and '23, the COVID-19 vaccine was provided fully subsidized by the federal government. The town received an administration fee for every COVID vaccine given for all patients, both insured and uninsured. In fiscal year '24, the COVID vaccine was no longer provided subsidized by the federal government. We had to privately purchase any vaccine we wanted to distribute. We are able to bill for the cost of that vaccine, and then we also get an additional administration fee. Since fiscal year '21, pediatric flu vaccine is provided free from the state. Adult dosing and the senior dosing for 65 and older is privately purchased. For the doses that are subsidized by the state, we do receive an administration fee. And then for the privately purchased vaccine, the department bills for the cost of the vaccine and then gets an administration fee. None of the fees or anything that we bill for, our residents never see the cost of that. It all goes through insurance. Insurance will always cover the cost of it. So we'll ask residents for insurance cards. They will never see any bill for a vaccine that we provide, but the town will get money back. The reimbursement rate and the administration fee is determined by health insurance companies. Typically, it is Medicare that will determine the fee and sets kind of the tone for the year, and then the private insurance companies follow.
How are the private insurance companies about, how good are they at keeping up with the rate? Like Medicare sets the rate, and then private insurance companies sometimes tend to reimburse lower.
Yep, so for this year, I have the rates on another slide, but they're usually within a couple dollars of each other. It's, they do a fairly good job of keeping within a few dollars. Otherwise, it's because private insurance is shoppable, they don't go too far from where Medicare sets the rate. So for, as an example, one of the flu vaccines, it's anywhere from $24 to $30 that they pay back for. So it all depends on the type of vaccine that's purchased. So for us this year, we paid $19 a dose.
Okay.
We will get back anywhere from that $24 to $30, depending on who is the insurer. And then we will get an additional $11.37 to $24.80
For the administration.
for the administration fee.
So
Since you
overall,
have
what's
to
the
actually do
ratio
work
of,
to administer it.
you know, not individual, but overall, the ratio of how much you spent on vaccines and how much revenue you got for it?
So
Is it 100%? Is it 80% because some people aren't insured? Is it more because you're getting these administration?
So we will get back everything that we bill for. We will get back, so it's all determined by the insurance companies.
No, I mean in total.
In
If I
total.
look at the numbers,
So
I just want to look at the.
we will
total.
get back greater than 100% of what we put in, because it will be reimbursed at the rate in which,
But in practice, is that happening? In total, how much do you spend and how much was the revenue?
I think we end up making about $11 to $15 for
No,
every shot
I'm
that we
not
give.
talking individually, I'm talking total.
For every shot that we give, is what I'm saying.
so I have
In
to,
total.
so I have to go back and look, and because vaccine up until this year has been subsidized, and this is the first year that we had to buy COVID, it's,
All right,
So
you
is it
can't
fiscal
answer.
year?
But I'm looking for a total number,
Yeah.
not by vaccine, not by insurance company.
Can we get that?
How much did
Like that
how
right
much
now?
did the town put out, and how much did it get in total?
Yeah, I mean, yes, we can get that.
Yeah.
It-
It's not a big deal, it just.
So we can get that,
Yeah.
it does take, so we're still getting claims from last year.
Yeah.
The way, because vaccine billing, we bill in the fall for flu, we will still be getting claims for last fall.
Yeah, whatever you have a complete answer for is all.
Yep.
You know, I don't need a specific period, whatever there's a complete answer for.
But we do make
Even if it's
more
2
than
years
what
ago.
we spend on
And
vaccine.
it's important to remember that for years, COVID was not, we didn't pay for COVID. So that's gonna be an outlier, so that not even really gonna be a very
Right.
accurate figure.
And so, and starting this year would be our best bet determination, because starting this year, going forward, we are now paying for the vaccines that we will always pay for. And then the other part of that is, if they're uninsured, previously the federal government had been providing an administration fee for COVID vaccine. So the vaccine itself was provided free of charge and an administration fee. That went away when the emergency declaration went away. The flu vaccine we get from the state for pediatrics, but there's a separate allotment for uninsured adults. So we don't bill anyone for uninsured adults, but it's, when we pull our records, we can see that that dose was given. And so there's a lot of nuances to it. We also see what we spent, and then, we'll buy 200 doses of vaccine. We are allowed to return X percentage, again, determined every year by the manufacturer. Some manufacturers are now, because the COVID vaccine is competitive, are now returning 100% of the vaccine, but it's not the most efficient vaccine on the market. Some it's only 20%, some it's 10%, and so it is not a simple answer.
All right, yeah, I have that impression.
So my question is hopefully simpler. The 11 to 15 that you typically get for the administrative fee, does that actually cover the time that you guys spend to administer to people?
Yes.
Yeah, we've been doing a lot of walk-in clinics, so it's, we're in office hours, people
Right.
are coming in.
Okay.
I think takes a big burden.
So
off
you're
of-
there already,
Yeah.
working already?
The way we are
And
setting
they
up the
can come in,
clinics
so, okay.
now, it definitely,
Good.
the way we're structuring clinics around our office hours. Whereas before, we were
You were doing very specific, come and get your vaccine.
At this hour.
place at this time.
or pulling me to a conference room to do it.
Is it-
And so we've kind of shifted and restructured the physical office so that I am able to do this stuff and then also step out and give vaccines.
Because it does pull you away when you have to step out and give a vaccine.
Yes,
So.
for sure.
The vaccines have expiration dates.
They
right?
do, yep.
So I imagine you're purchasing based on demand.
Yep, so flu vaccine is extremely tricky. You have to purchase your flu vaccine in January. So I will, and if you want a really good deal and ensure delivery, it will be in I will purchase our Abington's flu vaccine for next fall. I'll place our order as soon as we get back from the holidays. I did that this year and it was still delayed. We didn't get it on time.
Yeah.
We had a incredible demand for vaccine last year. And so we ordered accordingly. Across the state, demand for flu vaccine is down this year. Our residents are still looking for the flu vaccine. I'm not concerned about our stock at all, but across the state, we're not seeing that crazy demand. We placed an order in August for COVID vaccine, and it didn't come in. I was able to get a different supplier, rather than ordering a significant amount of vaccine like I had placed in August, we changed that order drastically, knowing that by the time we had to replace a second order through a different supplier, that demand would be different. And so,
And if we, have we run into situations where they do pass expiration date and we have to dispose of them?
nothing that we have paid for.
In that situation, and that's great. If we ever do get there, is that a loss, or is there some kind of recoupment for that?
So the flu vaccine expires June 30th of every year. Again, flu vaccine, manufacturers take back up to 20 to 30%, depending on how competitive they are every year. We've never had to return any flu. I don't anticipate us having to return any flu this year. COVID, again, we should not have to return any. We didn't order the allotment that I had ordered. The supplier we now have, I have enough lead time that I'm ordering small enough doses to ensure that we never run out, but we never have enough of a stock that would expire or have too much that we wouldn't be able to use.
And you had mentioned that already, the return percentages. And so you can return expired vaccines.
Some manufacturers. We are not ordering from that specific manufacturer, but it is out there.
And my last question,
Yes.
at least for now, the 50,000 that you have allocated.
Yep.
What percentage of that is the flu cost?
So this year to date, I want to say, when we allotted for the 50,000 last year, actually, I have it right here. So when we allotted for flu last year, we said that we were going to increase it for this year. So flu was, I believe, 23,000 allotted for this year, within that 50.
You might not know the answer to this, but there are liability questions starting to come up with COVID stuff. Are we completely protected for that?
Yep, so, as the administrator of the vaccine, we are not held liable, when they sign the consent.
Yeah.
That is, they're indemnifying us of.
Nobody is, Greg. Nobody's liable. Congress made that happen a long time ago. Sorry, anyway. Anybody else? Any other questions until we move on? I know you've got more to cover.
So here's the table. So going back, previous years, how the immunization fee schedule broke down, and then this year, into this season rather, they broke it up. So flu, the rates you can see go is from 14 to 77, and then they separated COVID before. It was just one administration fee, and then if you gave a second vaccine on the same day, you would get 8 to 15. Trending. Moving on to trends with permitting, that we have seen an uptick in food establishments closing in town. So for fiscal year '24, our permit revenue we'll see a small decrease rather. And then finding for our priority food code violations had been paused due to COVID-19. So if you look, there is a dip in that, and then we are back to fining for priority food code violations, so we will start to see revenue resume an increase there.
Although we kind of hope that stays low.
Yes, the goal is to not see that.
We don't want food violations.
And then we have seen an increase in body art practitioners coming into town, and so those permit applications have increased. So we'll start to see an increase in revenue there as well.
So food places leaving, body art coming in.
Yep.
That's good for the town?
Yeah, so with the, oh yeah, sorry, particularly with microblading.
By the way, I have a lot of tattoos, so it's not like I'm, but I have way more than you think. So it's not, I'm just asking, like, is that a good, do we need a strategy to get more
So,
restaurants in here?
like, regular body art shops, we have three, at the moment, there's no one
Yeah.
looking to open up a new one. Microblading is the big thing right now.
What?
Permanent makeup.
Oh, all right.
So there's a school currently operating here, so what they do is, they bring in, like 4 to 6 students at a time, they get an apprenticeship, which they pay a permit through us. They get all their qualifications then, and then move on to other towns. So we're reaping the financial benefit of getting them permitted as an apprentice, and then they're moving on somewhere else to actually practice.
Sure.
Although in the last 2 weeks, I've had 3 calls for people looking to open up new shops, so that seems to be a trend coming in. So it could be good.
We gotta try to figure out how to keep the restaurants, though.
That would be discussion and planning.
Right.
And then for revenue, I noticed you started a new program where you could have the extra trash that you could pay for. Is that generating any revenue, or is that?
So that wasn't a new program. We've done that before. It was just
Okay.
advertised and redesigned how people could request it.
Gotcha.
Just so we had a better tracking system.
Okay.
Or more efficient, I should say.
So where is any revenue associated with that? Or is that just?
Currently, the way we're accounting for the coming in, it's just under our waste as a general rule, which also includes all our recycling fees.
Okay.
So what we're bringing in for the additional barrels is basically covering the cost of the additional tonnage,
Gotcha.
hopefully.
So, this is our fee schedule. It was last revised in 2022. At this time, there is no, our board has no official plans, or no plans at all, rather, to revise this at all. Went and compared our towns to 8 local towns. I'm not gonna bore you with all of the numbers. But if the average of the 8 local towns is in red, it's the permits that they charge more for. If it's in green, Abington charges more for. So you can see that Abington is charging more, is in fairly good shape, doing well with our permit fees and our priority food violations and all of our application fees, as compared to the other local towns around us. If there's no data, it's because some towns either don't do it or just don't report it. So that was, yep.
Sorry, Avon really charges $10,000 for the permit?
Yeah,
Yes.
and,
Charge
how the
275.
AG has
So
to
that
pop
is-
into that, I don't know.
That is actually against the, again, speaking of against the law, that is actually, that has not been, that's not something we can do. We
That's why I
cannot,
always ask, is it
answer's
really
no,
against
so we
the law? I mean,
we cannot follow suit.
How many body art establishments do they have?
They have none.
They have none.
Yeah,
So
they're
it's
10,000
by
for a
design.
new permit, 1,000 for an
Exactly.
annual.
And so, yes, that skews that average, and so, and that cannot be replicated.
Why are some of
Seems
these
like
under
the average.
health as opposed to inspectional services, like septic or pool? Those seem more like they'd be
So
the building inspector.
health is so we do an all environmental, health, which is pool, septic, so that falls under environmental health, which is the health department.
But there are also inspections, not septic inspections, but pool inspections for like new pools that would go in that would be under the,
Electric and like all that.
yeah.
Like
yeah,
building would
inspectional services, but these-
inspect essentially the structure of it, health would
We,
inspect
it's the sanitary
The
code.
sanitation.
Okay.
Germs.
So the highlights of our budget, we are looking to request a couple part-time positions for the compost site, increasing to our travel budget for staff training, increases for our trash service budget, hazardous waste budget, and our sharps disposal budget, and then increasing the budget for our compost site maintenance budget. So the Increasing for the compost site, we're looking for part-time compost site staffers to be able to open the site for expanded hours and offer more services for the town. Currently, we store compost bins at Town Hall in the back parking lot. If we were able to store them on site over at Groveland Street, we could actually set them up, be able to educate residents on how to use them, and then have one actually going. If anyone's been over to the compost site, they've seen the trailer that's going to be opening as Abington's Attic, which is the swap shop. And the goal with that is to reduce tonnage in the trash stream by providing an alternative option for goods that can't, that are no longer wanted by residents, that could be needed by others. Increasing capacity for recycling and composting. We're looking for the part-time positions, so not eligible for benefits. Looking for them to be afternoon, evening, weekend hours. And the reasoning for that is those are the hours that residents have expressed to us would be the most beneficial to have the compost site open more. We get a lot of feedback that one Saturday a week, 9 to 2 is just not enough. And then we are looking for multiple positions because of just to ensure safe staffing. Ideally having 2 on site at all times for safety, also to be able to having that, we put 3 on there just to be able to cover for, sick, time off, anything like that. If we have 3, we can have kind of a constant rotating. And then also to allow to increase seasonally when historically we have a bigger demand for the compost site to be open more.
And just to add, we're not looking to eliminate the senior rebate program. We currently have 7 volunteers, and they're covering 32 weekends, 2 shifts per weekend. So we've had to close the site several times this year just because we weren't staffed. So we want to keep that on, but it would be obviously supplementing that so we're available more.
And that's in this budget in front of us already, those positions.
The request, yeah.
Yes.
Yeah, so the fact that you're only increasing salaries 4%, you're adding 3 positions? Good, well done.
We tried.
So those compost site positions, they're not in the Board of Health budget.
Oh.
They're underneath, under waste collection
Oh,
salaries.
okay.
You just rained on Christmas parade.
I do have a question though, Lindsay, about
Yes.
the,
Next year.
is there any revenue from the items that people, when they pay to drop a mattress off, when they pay to drop a television off, do you just break even with that because of the cost to actually dispose of it, or is there any revenue from
Yeah,
that?
we're breaking even, and we were actually, we went with a new vendor this year, and we were able to drop the prices, and we've seen a significant increase in what people are bringing in to recycle and keep out of the trash stream, so.
Or on the side of the road?
Yeah, Chestnut Street's a popular spot. We don't take sofas yet, so that's probably why you see them hanging around town, but.
Saw one yesterday.
Yeah, so, yeah, we try to keep it at a break even.
I'm going to channel Greg for a minute here. You talked about Abington's Attic and things that people might drop off. Greg will want to sell those things if we can. on Craigslist
Well, the Salvation
or
Army does.
Oh, there'll be people there. that
Facebook
will
Marketplace.
take it and bring it to those places, yeah.
Yeah, I mean, if we were fortunate enough to get in a position where we had excess stuff, that might be an option. Right now, I'm begging town hall staff to give us stuff so that I can open it with the full shop. And we got a few pictures here of what we've accumulated so far.
So the reason that it's a swap shop and not a fee for service or charge per item is, again, the goal is to get the stuff out of, keep it out of the trash.
Yeah.
And if residents are bringing it to us, for us to sell, then they're going, the thought process is if they're gonna sell it themselves. And if we want it out of the trash, we want to encourage them to bring it down and swap. We want it to be a spot for community. And if it's, someone doesn't have the money to go get it, here's a spot where they can come and grab stuff.
Have you ever thought of offering an incentive for people to bring it, not just that it's free? right? So if you really want people to do that, you would say, I don't know, vaccines half off, I don't know. Something else that you offer. I don't know, I'm just saying, I don't know what the.
Free library card.
No, but something else, you know what I mean, like, can you offer an incentive to do it? If that's something you really want to do, and which, I mean, how many things do you have?
I mean, the trailers we're getting there. Once we open, and it's advertised more. Right now, we're working to get the electricity to it and everything else. It's not ready to be opened. I'm sure there are incentives that we could do. I mean, vaccines we can't.
I don't,
No.
It was just because that was just there.
Yeah, no. But then are we spending money
Give a
on?
discount on taxes, Scott. I'm just saying something. I don't know what the legality and all the other stuff, but if you really want that to happen for people to bring this, so they stop putting it in the trash and stop doing it. If we really are very interested in recycling and do stuff.
Probably decrease our trash hauling bill, which is, up, what, 7.5%?
You mean the recycle, hold on, are you saying the recycling bill or the trash
That's the
hauling?
incentive for the
Yeah.
town. I think Greg is saying give the person an incentive, so like,
Yeah, the person needs the incentive to not throw it in their
if you
trash.
bring sports equipment, we'll give you
Yeah, something, I don't know, I don't know what could be, but.
I think part of it is that's what our current third hire, Eddie, that's his job is education and recycling education. So if we're informing people, if you're throwing your toaster in the trash, that's why your town is paying $1.3 million for trash every year. Get it out of the trash stream, reduce your tonnage, bring it here. Also, having this swap shop and running it strictly as a swap shop is part of what's getting us funds for our recycling dividend program grant. So that was part of the initiative to get it going.
I would think
But
too,
we-
if it has a community feel, that, that would be an incentive even for,
Very
Girl
successful
Scouts
on
to
a
sell
lot of
cookies
different
out there while people are dropping their
Yeah.
things off or swapping their things, if it becomes something that,
I got a coffee maker I'm gonna bring back, actually.
We don't take electronics. But actually, I mean, to that point, if we have.
So what happened to the toaster?
Yeah, well, but to that point, so
Cut the cord off.
a lot of the towns that are running a swap shop have just strictly volunteers there.
Yep.
So they don't have the time or resources to
Correct.
test equipment. And
Yeah.
while we're all good people, there are plenty of people that are gonna bring broken equipment to try to just avoid paying for it.
Yeah.
If we had some part-time staff down there whose job is to run that site, then they can test equipment and then we can certainly.
No, so I thought
You
were
could bring
messing
that
with me.
coffee
I can't. I really can't bring it, okay.
Give us some part-time staff and you can actually bring your coffee maker down.
So we asked for an increase for travel for staffing. These are just some of the conferences and educational opportunities that we are able to attend. I mentioned that a couple of us are going to the Preparedness Summit. Some of us are going to the Inform enteric disease investigation. So the reason for the increase is with additional staff on board, it costs more for all of us to attend. It is, public health, environmental health is something that's constantly being changed, updated, best practices. We all have continuing education requirements that by law we have to maintain and uphold. It provides for incredible networking opportunities to get, again, the best practices. And so that is something that we need to continue to attend. Unfortunately, public health and environmental health conferences and educational opportunities are not very often held here in Massachusetts or even in the Northeast. Most of them, as you can see, are San Francisco, Colorado, New Orleans. They're not really local, with the exception of the Mass Health Officers Association and the Public Health Nurses of Massachusetts. Most of them are not near here.
So 2 questions on
please
Beaver,
ask.
BeaverCon.
Yes.
First question, obviously, is what is BeaverCon?
So beavers are a keystone species. They help create wetlands, which has actually wetlands have more biodiversity than coral reefs and rainforests. So BeaverCon is education on beaver management as opposed to trapping and killing beavers. Trying to teach communities to actually work with them and manage the problem areas
So that's BeaverCon, it's just everybody getting together to talk beavers. We learned a lot about beavers this year. It's pretty fascinating how helpful they can be to the community if managed properly. We are the land of many beavers.
So this was my next question is, do we get a discount because of that?
You would think.
Because we should.
We should, absolutely, we should.
We will ask about that.
Does the compost provide composted dirt to residents that they can?
Yeah, it's an underutilized resource. We have Mount Abington and mini Mount Abington currently growing over there, which is usable compost. I have spoken with a couple of local companies to have them take it for fill, just to try to reduce what we've got up there. And we'll hopefully do a better job this year of educating residents that, when you're dropping off your leaves, you empty a barrel, fill a barrel back up again with nice black.
I think a lot of people don't know about it. My husband and I went up 2 years ago and grabbed a couple of barrels full, and
Yeah, well, after
a lot of people asked, like, oh, where did you get,
Yeah.
you can just put it into the compost.
After I cut the cord off my coffee maker, I'll be there.
Trash service. So the contract extension will be signed by January 1st yes, January 1st. We have had no complaints from residents, with the exception of a couple one-offs, as compared to previous haulers. I started in the days of a previous hauler, and the phone does not ring nearly as often. We did ask for the increase in the budget as a buffer. Market determines the cost of trash and recycling. We don't have an input of that market cost and can't shop what the market determines the cost to be around. Surcharges, although we can negotiate and contest, we do need to be able to absorb those if needed. We are exploring other options and various other ways to save on solid waste. One of the things that we have explored is a tabletop composting to decrease weight from discarded food, looking into direct billing from the transfer station as opposed to being billed from the transfer station, billing the trash hauler, and then we're getting billed from the trash hauler, splitting dumpsters from the curbside pickup into from commercial and then curbside. So we're looking at all the different options and seeing what the best solution would be to try to decrease that bill.
Can I ask, what's going on, what's the latest with recycling? Because there was a time when we made money on recycling and then we were paying for recycling.
Yeah, we're still paying.
And how does that
There's a
compare
time
to
when we're
trash?
paying more for recycling than for trash.
Yeah, the rates vary, but I want to say just on average, we're paying about a third. The cost of the recycling is about a third of the solid waste.
Okay.
So what was the
That's
cost
much
per
better than it was 2
ton
years ago.
for solid waste?
So in November, trash was 104, and recycle was 100 even.
Yeah, so less than higher.
When you said a third, what were you thinking? That'd be like $30.
Yeah, so we're not.
Oh, all right,
Yeah,
got it.
it's
I didn't
gone-
know if she's not saying the right.
Yeah, no, she's got the right,
All
so
right.
it's gone up since the,
Once again, Scott,
So it's
when
one-
are we gonna stop recycling when it goes into the landfill?
So it all goes in the landfill.
I know, that's what I'm saying. Could we just all just have green buckets? Green tops?
DEP says we can do it any other way.
So it's 104
Until
a
DEP
ton?
changes
If we're paying 104 for trash. and less than
104
what we're doing
and then
for
100.
104
Then
for
recycling.
Trash.
104 a
It
ton
was when we were
for
paying
solid
104
waste.
for trash.
Yep, and then 100
100
for recycle.
yeah, I think when
But
China
they weren't
first stopped
the
taking
exact
it,
same
they
amount
just-
of
Yeah,
tons
it was
either.
through the roof.
There weren't the exact same amount of tons either. So unless we had 100 tons of recycling and 100 tons of
Right.
solid waste, they're different numbers.
No, yeah, but that was just the price per ton. I
Yeah.
mean, we have the numbers going back from July 1st, but that's just the price
Yeah.
per ton.
Yeah.
Which is probably 10, $14 more than when we signed the contract.
At least.
I think it was 89 or 90 then.
Yeah, that sounds right.
This is, I mean, statistically, I think it was like 3% increase year on year for both.
Well, it was tied to the CPI too, right?
Right, and that's after commoditization ended for recycling. And that's hard to predict for actual solid waste, but it's easier to predict for recycling now that it's not a commodity. You can expect it to be anywhere between
It's just gonna
90
keep
and
going up.
110.
'Cause it
And
doesn't-
actually, if you get it under 100, that's like a miracle,
Mhm.
especially this far north where there is no landfill that they can take the solid waste to, as opposed to like a lot of the southern shore, South Shore, and Western Mass towns.
And
God,
that-
I hate that so much that I still know all that.
That contract extension, are we on a year by year, or are we doing 3-year contracts, or 2-year?
It's one-time, 2-year extension, so.
A one-time 2-year extension?
Yeah, so then in 2 years, we'll have to renegotiate for a new contract.
Okay.
It does, so the increase in budget is a buffer. The last 4 average is $1,240,000. That's what would actual.
Well, it's not just a buffer, because we do know there is a specific increase in there, right?
Let me finish. If I look at the actual for waste hauling, on that line item, that's $1,600,000, the average actual is $1,240,000. The highest it's ever gone is $1,300,000. Now we have a $300,000 buffer in there? That's the way I look at it. And Andrew, what's the actual, what are we projecting for this year?
For this year, it's about, we spent about $550K year to date, so that's 110 per year. So that's a little bit over 1.3 million.
Yeah.
A little more than 1.3.
So why are we increasing another $100,000? If we've never gone over a million, say 310, we budgeted $1,500,000 last year, we're adding another $100,000 in there. There's already a buffer in it. Now we're adding another buffer. So, I mean, I'm just looking at, we're talking about a $300,000 buffer in the budget. And can we use that someplace else?
Probably.
Or, heaven forbid, reduce the budget.
Well,
Thanks, Chris.
I didn't mean to make a joke.
yeah.
So do you feel comfortable changing that to 1.4 million, or 1.3 million, whatever, 1.35 million?
She's locked out of the budget at this point, Andrew and I will take care of it.
Sorry, do you feel comfortable changing that to 1.35 million?
We will at some point, but we're not
There
gonna
you
do
go.
it right now, we're not gonna promise it either,
Why?
because we're not there yet.
No, but why, historically, why would we be so far up? If you look at historicals. why would we be
Because
so-
right now, I mean, we are very conservative or very concerned on the budget in general. So as we massage this and get down to whether we get some real numbers in, maybe a few more months of hauling,
Yeah,
and find that, you know, it is gonna stay steady, or the gas prices aren't gonna go up, and we're not gonna have more escalations because of gas prices, or there isn't gonna be a problem with the CPI, that we're gonna get another ding on that, then we'll probably reduce it, but we're just not there yet.
It just doesn't seem like we should be, if we are at $1,500,000 budgeting last year, we should at least just stay with that. Like, we shouldn't exceed that, because historically, we've never exceeded $1,300,000. So why would we go from 1.5 to 1.6? Like, just leave it at $1,500,000. I mean, I understand creating that buffer, having that, but it just seems like we haven't,
Too much of a buffer.
too much of a buffer, yeah. And can I, just on the new position that was added last year, how much outreach have we done to the schools with this new position? Because that was one of the drivers for that position last year.
Yeah, that's a work in progress. We haven't done anything yet, but that's one of the things we're working towards.
Is that planned for this fiscal year? Not FY '25, FY '24? Because that was one of the things that I thought was a great presentation last year, that we were going to do.
Yeah, I think for the new school year, going into the new school year, we'll look to have some stuff lined up.
So we're not gonna do anything this year?
Don't plan at the moment, but,
Okay.
you know, that's not to say we can't get something rolling in the meantime, if we just, you know, bump that up as a priority. We've been kind of looking at the day-to-day curbside operations as the focus right now, so
Okay.
just a matter of shifting.
And how has that been going for this new position? Like, when you say, because we were talking, we don't want to be the trash police.
Yeah, yeah.
But now that we're out there, what are we finding?
Yeah, the first thing we tasked them with was taking a look at, so Boston Karting reports to us their tickets every day. So we were looking for trends to see if there's a day of the week that's heavier, because then we can identify neighborhoods. So that information has come out pretty much every day is roughly about the same. There's no standout trend. So the next step is either having him go out with the driver or go out himself earlier every day and kind of, I mean, so any of us on trash day, if you drive down the neighborhood, if you see a barrel with it's lit up, that's excess trash, bags next to it. So maybe starting to identify the neighborhoods that, you know, maybe their tonnage is coming out the same, but they obviously have excess trash. But that's a lot of man hours out on the road. We're ordering violation notices to tag the barrels. The whole idea was to try to identify areas first so we could do more direct education, but I think it's gonna be a little more hands-on.
Thank you.
So our hazardous waste budget, we did ask for an increase in. In previous years, we've been able to use that RDP grant money to offset the expenses. Due to the increasing regulations and tighter standards, the dollar value awarded in the RDP, it appears it will be decreasing, not allowing us to use the RDP money to offset these costs. Looking at the expenses going for fiscal year '24, the hazardous waste day in Abington, the events outside of Abington, to empty our mercury shed, and then the dues to be a part of the cooperative bring us just shy of 9,000. And so with between the RDP and the increase, we're looking to be able to cover those, going into that.
Are we gonna have anything with a cord day?
For Dan's coffee maker.
Yeah, so,
Half a quart.
yes and no.
Anything with half
The
a
problem,
quart.
when we were having those, we had a vendor that was taking everything.
Yeah.
He's no longer doing that.
Oh.
The current recycling that we have, you can bring anything to the compost site with a cord. There's, I think it's a $5 or $10 charge for miscellaneous electronics. So there's a cost involved, but we can take any electronic at this point. If I can find somebody who's willing to host a day again, we would absolutely love to have one, but I think other towns are in the same position, that just, nobody's in that game
No one's doing
at the
it.
moment.
So we actually added excuse me, I can't speak tonight, I'm so sorry. Added an additional line item of Sharps disposal. So kind of the backstory here is in 2006, there was a pharmacy needle access law passed. Law included a mandate statewide that we need a program to dispose of needles and Sharps safely. Long and the short is effective January 12th. There was a complete ban on the disposal of Sharps and household trash. The state's plan to roll out this no needles, we need a Sharps program, was to hand it off to the local level. The residents had been dropping locked Sharps containers off at the health department. We were packaging them up and we were dropping them off at the firehouse. And it was getting picked up by a bio-waste container. It was the health department's bio-waste and Sharps, and it was the residents as well as the fire department. Once they picked them up, there was absolutely no way for the company or us, or the fire department, to know what was what. So Chief Glenn and I sat down and we had the conversation about how do we differentiate this. And the best way we came up with was for the health department to take back the Sharps program that what used to be a line item for us, and the fire to continue having their own line item, which is what it is. So that is why it's back on ours. There is no rhyme or reason for how many boxes come in. Chris can attest, sometimes we get all of them in one day and we have 3 boxes going out. So we did the average of what we send out. And, we were conservative with that. And so we just needed, that is why we are requesting money for Sharps. And then the increase with the compost site, maintenance, that is our compost site pile. That is actually at one point in the fall looking really good compared to some of the days. Currently, we are managing the pile by pushing it back, thanks to our DPW, and we actually had a very generous resident come and volunteer some time and equipment. So now it's potentially just good for fill, because it's not being properly turned and chipped. And so we do need that money to appropriately grind, chip, turn, to make it adequate compost. And so that is something that has to be done every few years to maintain it. We did recently find someone who, within that same budget, will take some of this away for us to allow us to be able to manage the pile a little bit better. Because it is quite large. This is before our curbside leaf pickup. And then thank you to the Eagle Scout candidate who popped this awesome kiosk out in front of the gate so that we can pop information inside. It is lit 24/7 by solar lighting. And so we can have information about, you know, hours and what's taken, what's accepted, what's not, how to get in touch with us if there's questions, anything like that. And that's the end. Thank you.
Any last questions? from the group?
No, just so overall, if you take out the waste removal, the health department budget is about,
Not that big.
About 300.
yeah, so it's even less than the library.
Yeah.
Right, so it's less than 1%. Thank you for all you do.
Thank you.
Yes.
Thank you.
Might be less than a half.
Yeah.
Quick question, probably more to Scott. Are there any, like, revenue-making town events that we could advertise that Eddie Murphy was gonna be there? And see if people, extra people would come because of it, now that we have Eddie Murphy working? for us?
Line by line recreation of Delirious. For you old
He
people. that's a
might
great
be a
deal.
little upset with us. but For a fee. For a fee, we could get him to start signing
Well,
stuff,
so, I mean, if we're making extra money for it, some should obviously go to him.
right?
No,
Thank you.
Thank you guys so much.
Thank you
Thank
very
you.
much. Last but not least,
To right in front of the cars. Help yourself.
We had a Christmas party last
Did we
week.
get
I
one
still have cookies in my office, so I do not need to be standing.
I think the way we peppered them, they had to get out of here.
I try to be quick, but I don't see that happening. I'm sure you guys have a lot
We
of
don't
questions for
expect
me.
quick from Morgan, so
No,
it's not on you.
yeah. All right, I'm sure I'll just wait for Daniel.
Yep.
Okay.
Is that bad?
Not yet. No. Feel bad. He's had quite the situation.
So what is that thing? This black thing?
It's a recorder.
It's a
No,
recording
like a thing
device.
under it.
The box that's holding up the recorder. This is just,
I thought that's
Just
what you
for
guys
show.
were talking about the other day, the box.
No,
No,
it's
Like,
like-
oh,
it's
a
like
special recorder.
CD
like-
boxes
What
or
box
something.
It
were we
looks like
talking
somebody
about?
put CDs.
Yeah, it's an empty CD box.
That's just to make it higher.
Okay.
It does, but sometimes the mics don't pick up stuff, like when people turn them off.
Maybe people turn them off and talk about that.
Yes.
All right, I'll start. So I really didn't change much to the mission. It's really the same. We serve 6 communities, but, you know, the total is really Rockland and Abington. Just partial communities for Hanson, Pembroke, and Hingham and Whitman. We have 3 treatment plants, 2 are surface water, and the one in Abington is well water. And we have 3 storage tank facilities. So in total, we really have 9 buildings. With the upgrades, we'll be adding another 2 buildings. So it's a lot to manage.
I'm sorry, I already have a question.
Yeah.
What do we do for Whitman and Hanson?
We have some small accounts on those, like, bordering towns.
That we provide water?
Yep, we do, yep. We
Is
do
that
have.
just because
It's just out of.
the network?
Yeah.
Like the
The
pipe
way that the
network
pipes are.
makes it so that it's easier for us to do it than
Yeah.
their own towns?
And the same with Hanson, the treatment plant in Pembroke that we have the rights to, that's been there since like the 1800s, it's kind of really neat. Those accounts just really go right on the transmission main, so it just really works out well.
We have a certain amount of Abington that's fed directly from Brockton.
Okay.
Yeah. Yep. So sometimes that happens, but, we don't have too many accounts, and we call those accounts the joint accounts, so, there's Abington, Rockland, and joint. So that's really, in essence, our mission is obviously to provide reliable water and service for the communities, while making improvements to the system. And we've had some really decent and great, achievements this past year. We landed the $13 million PFAS grant, not grant, I wish it was a grant, the loan. And on this past Friday, we were notified that they voted for it to be a 0% loan, which was great, fantastic. There will be loan forgiveness with that, but they tell you once they award all of the loans, and then that kind of comes later. So the borrowing will be a little bit later on when we were notified. The bidding for that process has been completely done. We've awarded the contract to Winston Builders, and there's some subcontracts in that, but they handle that whole thing. And we also have completed the filter vessel procurement, and that's being done all through using ARPA ARPA funding, and those vessels have been secured through Calgon Carbon. So that's great. Those were all done through Rockland and Abington ARPA funding. We also applied for a $50,000 PFAS remediation grant. So in the same, with everything going on with this loan, we're still, going after other funding to try to knock down that price. And so I'm pretty sure we're getting that grant, which is fantastic. We're going to use that to change out the media over at Myers Ave. It costs about $30,000 to $40,000 every single time we do it. So, that'll be great to do. We do have to tell them what we're using that money for when we secure that grant. So there's certain things we can't use it for, like the mailers, which I really would love to do, but they don't let me do that. So we also applied for a Water Management Act grant for reservoir modeling, so we can better watch how climate and increased consumption will affect our sources, which is fantastic. That hasn't been done in a long time. We replaced 279 water meters in customers' homes, made 20, and this is just in Abington alone, so we also have Rockland in the joint accounts too, so it's probably double. 20 different piping repairs. We replaced 5 hydrants, and that's just on us. We also have a contractor that actually comes in, and if an accident occurs and a car takes out a hydrant, they go after the insurance company to replace that, and we get the funding for it, so it replaces it for us. When that wasn't done for, that program started last year, so we're saving a lot of money with the hydrants, and they actually will reimburse us through, if the guys go out and it's on overtime, they'll pay back the salary too, which is great. And we did 1150 dig safes, and 420 various customer appointments, which, some people might call about dirty water. We need to go and flush out their, service and things like that. So, or we might need to go out and, watch someone do an inspection or something like that. So that's another type of appointment.
Can I ask a question?
Sure.
Weren't you gonna start a program with replacing toilets or something like that? Did
Yep,
that
we're
ever-
still gonna do that. I'm gonna be putting in an article for that, and that will fund that whole project. It'll be great for conservation. And we are participating in a study for looking for another source of water through MWRA, and Rockland and Abington ARPA funds also funded that as well. We're excited about that. And we also.
I'm sorry, if
Yeah.
we did that, would we still, like, we're obviously doing the 13 million in PFAS right now. If we got water from an alternate source, would that kind of all be for naught, or would we still be
No.
using our own internal water supply, or?
I don't think the MWRA thing's gonna happen for a long time.
Very
So this is just
expensive
getting,
too,
it
isn't
is,
it?
it's very
MWRA?
expensive,
It's really
yeah.
expensive.
Mhm. So
No,
this
it's-
is just getting the wheels in motion and just being ready in case it ever is something
Yeah,
that we wanna
the-
do.
This way, we want to be ready to have at
Yeah.
least a backup.
Yeah,
vehicle to
with,
run through it.
when the naval base people were here, they were saying that's their primary objective, that's the first thing they have to do, and they're saying it's probably at the earliest 4 years away.
Yeah.
And
And
there's
that-
other
that's
sources
actually-
And,
already.
and MWRA was only one of two possibilities.
I think
There
it
was
might
that
be,
and
yeah,
Brockton.
the other one.
So,
Yeah, is
and
more,
Brockton definitely sounded more likely.
mhm,
Because
a
the
little bit more on our
MWRA
radar
one
as far
had
as
to
timing
go, was
goes.
like 80 million or something like
Yeah.
that to get it.
Yeah.
It's got more.
To there.
Mhm.
True.
MWRA does?
Yeah.
Yes.
Yeah.
Well, I'd
So-
rather have that.
It is Massachusetts.
Yeah.
Very, actually,
Political backing goes a
It's one of the best
long way.
sources in the country.
very clean,
It is.
clear,
Yeah.
PFAS-free.
It would be great for an emergency source if we didn't take it on as like a complete source or alternate
it
source,
is.
so
It's
it's,
years away.
yeah, very
regardless of-
much. But-
Regardless of which source and what happens.
Right.
It's
Just being prepared is
a long
is
way
where
off,
we
but
want to
being
be.
prepared is definitely better than
Mhm.
not.
Yeah, I mean, there's all kinds of things you gotta take into consideration when you're taking other water from another community. What's the water quality gonna do? You know, the characteristics of one water mixing with another, you know, piping modifications, things like that, so. There's a lot to take into consideration, and this study will do all that, so it's good to start
Implications on getting rid of it too, right?
getting
When
rid
you take it
of.
from one watershed and the sewer is going out to another. So I think there are implications on that become interesting.
Yep. So we also applied for a $5,000 safety grant, which will be, the things that I put in for that would be primarily for a street crew. And if, you know, we get that, I'll do one next year for treatment. And, you know, our goals are always the same. We're gonna try to continue to, you know, provide exceptional service for our customers' employees, and we're gonna focus on conservation and education. We're redoing our entire website. I funded that, and so I feel like that's gonna be really good for communication with the community and things, because I feel like our website was lacking a little bit, especially in the Rockland side. So we're actually merging the two together, and it's gonna be a joint website. And we're just gonna continue to improve treatment and piping modifications, as we always do. So getting into the revenue and the highlights and things like that, it's my budget. I have 3 budgets, so I have an Abington, a Rockland, and a joint budget. And as it says here, the highlights, I increased the police details, and you'll see increases for an intermunicipal agreement. And I'm not sure, and that lies in the joint budget, and I'm not sure if you want to kind of dive into that and learn more about the joint budget, because Abington does pay a portion of that joint budget, and that's where that increase does come from. So if you want me to dive into that really quick and
Yeah,
explain?
great.
Okay, because I brought that. It's not really something that I think has really been done too much in the past, but I think it's something that would be a little important to highlight, so. I did bring that. I hopefully brought enough.
The joint budget is covered by the water usage charges.
It is, yeah, so so as we're an enterprise account, obviously, and all the water bills and everything is what funds our department, obviously. Taxes, and for those at home, taxes have nothing to do with our department, it doesn't fund our department. Primarily, the water rates is really everything, is where it comes from. So the joint budget is really where treatment and everything, the heart and soul of the water department is. And then what happens is I have to do a calculation, and I break it down, it's into the Abington share and the Rockland share. So it's not 50-50, it's not funded that way, Abington and Rockland. It's funded basically based on consumption. So if Rockland consumes more water, then they're gonna pay a bigger percentage. And if Abington, vice versa, but it's usually, Rockland usually pays more than Abington because they have more people. So it's usually trending, as you can see down the bottom, usually it's 47% for Abington and 53% for Rockland.
I was going to say, most of the years I've been on, it's been 53-47.
Yeah.
Same for you, Bob?
Yes.
Yeah.
So I do have another sheet that explains the split on how I calculate it, if you want to see that too. Sure. But it's kind of complicated this year, and it's 2 pages.
And I recall last year we had a discussion about the cybersecurity after all those plants were attacked and whatnot.
Yes.
So where is that? Is that consulting fees that are paying for that?
That
or-
would be, yes,
Okay.
and consulting fees.
Is that the same vendor that we use?
Yes, and actually the EPA has kicked that up a notch, so we have to actually do certain special things with, in our department in order to make, meet certain guidelines with, it's 2 sheets.
Oh, it's 2
There's
sheets.
2 sheets, of course,
I brought
obviously.
them.
That's all right, we can share.
Okay.
All right, you give one to them.
Thank you.
Thanks. So, we had, so the way that I have to calculate the split is, I go back to the last full year that I have on the books, which would be FY '23. And it's obviously just a projection because you don't know how much water is gonna be consumed every year. It changes year to year. So, as you can see in FY '23, you'll have the Rockland side, Rockland's on the top if you just kind of want to not look at that, that's fine, or you can use it as an example, it's the same thing as Abington. So, you know, for the first green box down the bottom for Abington on the first page, you have the rate of $5, as you can see in red. We had that for July and August. So I had to actually do 3 different rates because we had $5, $6, and then $8. So it was kind of a pain this year, but usually it's only 1 rate, but it's fine. So you come down to the bottom with the green, and it will give you the way that you want to actually calculate it is you want to find how much water was consumed. So you need to take out the basic charge, which we charge every single resident, which is $43. You take that out of every single water bill, and then that leaves you with what every consumer has consumed, has used for water. And that'll leave you with 100 cubic feet down the bottom. And so you just take that 100 cubic feet and you would add it to each rate. So the second page would be for March through, August through March would be the second box, and it would give you the 240,000 per 100 cubic feet there, and then the 96,000 down the bottom as well. You add that all up, and you get the 427,000 and change for the 100 cubic feet. So you do that, and then I have to do it for Rockland as well, and down the bottom is the math for the split, if that makes sense.
So
No, it's
our
kinda
water rate went up
complicated.
$3 in 1 year?
It did?
What accounts for that? Was that the PFAS project?
Yes.
Okay. Where was I when that happened?
So, yeah, it went up in September.
Didn't realize the ramifications.
Yeah, we would have never been able to make that PFAS payment if we didn't go up on the rates.
So when people are complaining that they're, and I don't mean complaining, that's probably not the right word. When people are-
Concerns, upset, yeah.
When people are saying that have opened their water bill and it's tripled,
It's because of the PFAS loan.
the rates.
It's
going
because
up.
we had to go up on the rates because we're funded by the receipts. And in order to pay for that PFAS loan, we had to increase the rates.
To fix the water.
To fix the water. Yep, and it wasn't anything that the water department did. It
No, it's
was.
Regional, everywhere is having the same
It's
problem.
actually worldwide.
Yeah.
Yeah, it's a shame, it really is, that we're all finding this out, this late in the game, if you will. But I think it's necessary and it's important that we fix it.
And I just want to go back to that, the PFAS in Abington and Rockland's water
Yes.
has not changed.
No,
It's the same as it's been. The
Yeah.
regulation changed.
the regulation changed. So
The
we went-
water's the same as it's always
Correct.
been. Nothing's gotten worse, nothing's happened to our water supply system, like it's, the,
Yes.
Along those lines, and this
Yes.
is one of the questions that I get asked a lot outside of the meetings, do you want to talk about kind of where the state levels versus the EPA levels
Sure.
are?
Well, that's kind of a loaded question, but,
Yes.
the federal limit is 70 as of right now, parts per trillion. It's always been 70 since the dawn of time, and then, come, I believe it was January 2021 or 22, they dropped it to 20 in Massachusetts. As long as you're meeting the federal limit, the feds are happy. Every state can choose to be lower than that if they want to, and Massachusetts chose to be at 20 for whatever
So
reason they want.
3.5 times lower than the
Correct.
federal limit. So when it was 70 parts per trillion, we were fine.
We were fine, we were meeting the
When
standards.
Massachusetts dropped it, we're typically, most of our plants are below
In Abington and
in
Rockland?
Abington, Rockland.
The one in Pembroke is below.
The one in Pembroke is below, the others
The other
kind of-
two are above.
Are they consistently above, or
Yes.
they fluctuate?
No, the one in Rockland is fluctuating, but not enough to allow us to pass. The Abington groundwater treatment plant is above, but it was above. Retrofitting a groundwater treatment plant is way easier than retrofitting a surface water treatment plant. So when we found out that the PFAS was there, we shut that treatment plant down immediately. We were able to retrofit that within 10 months, if I remember correctly, and we were up and running, and we get no PFAS coming out of there. And, the way that we do things is we have to monitor it. The media kind of gets exhausted over time, and then you start getting a teeny bit of breakthrough of PFAS, but we never let it get to the standard or even close to it. We shut the treatment plant down, and that was that $50,000 that I was talking about. We have to take the meteor out, put it back, put new stuff in, and it's considered hazardous waste. It's kind of crazy. But every water department's dealing with this for the most part, I would say. And the ones that aren't, I'm really jealous of them, but, we're actually ahead of the game. We didn't, of the regulation, we didn't have to do the testing as early as we did, but we decided, we knew, things were gonna come down, and we wanted to get ahead of the regulation and everybody else that was gonna be waiting in line for all of this material and the vessels and all that. So we decided to just do the testing and get it done. And once you test, you have to report the results you get. You can't just say, oh, we're gonna wait. You have to report it. So when you test and you find out it's there, you gotta report it, you gotta send out the notices. You don't have the treatment yet in place. Everybody's upset and asking what you're doing, but you have to tell everybody that it's there. So that's kind of the catch-22 that you get yourself into. So it's kind of a tough position to be in, but.
As we sit here today, the safety of the drinking water in Abington is?
I would say like 90% of Abington does not get the water from the treatment plant in question in Rockland. The treatment plant in Abington that is above the PFAS limit in the raw water, which is untreated, when it goes through the treatment plant, there is PFAS treatment there. It's none detected when the media is brand new. So it's that they consider it fine per the standard. So.
And PFAS
They're not-
aside, the safety of the Abington drinking water.
We're meeting all regulations. Yep.
It's a great answer.
I was thinking.
That's the only
Thank you very much.
Well worded.
But if people are having issues
It's
with
true,
brown
though.
water, their water's smelling, or they're, that's something you want to get a phone call for.
Absolutely, you can call us. I mean, there's different reasons why, your water might smell. A lot of times it's coming from your drain and you don't even realize it. And we, kind of help coach people through how to fix that. If you're on a dead-ended street, sometimes the water ages a little bit, and that can cause the water to either turn different colors or, get kind of smelly. We can go out there and flush the street for you. We can flush your service line. I mean, your service line connecting your home to the main is just like a tiny water main. So if you think about a water main and how kind of gunked up those can get over time, your service line can get gunked up like that too. So we can remove your water meter, we can go to, set up an appointment, we can go and flush your house. And a lot of times that remedies a lot of problems that people have too.
And what does that cost?
It's free.
Nothing.
So we just need your time, that's all, so we can get in your home.
And so, for people that might be interested in doing that, they would just call the Joint Water Works.
Yep, and we'll set up an appointment, and that's one of the highlights that I mentioned when we do 420 other various appointments. That would be one of them. So we're happy to help.
Is there like a recommended time frame in which you should do that? Every 10 years, every 5 years, every 20 years?
Anytime it's just, anytime it's bothering you, you just give us a call. Sometimes people don't have any issue, and other people have it. It depends on your service line material too. So if you have PVC, you might not have as much of an issue as someone that might have copper, because it's metal and as opposed to PVC.
Or the age too, right?
Age,
How
yep.
old.
So it all depends on stuff like that.
Some of the pipes in the town are
Yeah. Yep,
Some
I
are a
mean,
lot.
think about where we live, as where the country was settled, we're kind of up against that age, so it's a lot to consider. So that's how, getting back to this though, that's how I calculate the split. I know it's a lot, but usually it's one rate, and it's not 3 different rates, but we started off with $5, we went up to $6, and then the board voted to $8 because we were concerned about not having enough revenue for the PFAS loan. We weren't sure about when those payments were gonna start. I've got a rough estimate of when those are gonna start. I don't know if you know that yet, but I was told that they might start in FY '26, but that's still up in the air. This whole loan is very up in the air right now, but the 0% has been nailed down. They say that usually with the loan, with SRF loans like this, once the project is about halfway done, that's when the payments start, or when there's 1 year left on the project, that's when the payments might start. So they're, the drawdown, the drawdown predictions for the loan and everything looks like about FY '26.
Quick question, on the PFAS thing?
Yes,
The 13 million for that?
yes.
That's combined?
That's just Abington, and Rockland has 13 million as well, so it's
So if it
26.
is, so if the water the water in question, that's really the issue? Isn't really half and half?
What do you mean?
It's not really feeding half and half?
Well, there is a plant in question in Myers Ave, in Abington as well, that has PFAS problems
So-
too, so we're gonna be doing upgrades for that, with the
Oh, so it's
13
more
million.
than one place?
It is, yeah, but there's
thought it was
no
one thing.
issues coming out of that treatment plant right now. I just wanna make sure everybody knows that people in Abington don't really have too much to worry about when it comes to that right now currently. But when we're doing upgrades, the 13 million is going towards Myers Ave upgrades.
Got it.
So when we did that quick retrofit, we didn't want to be down, with the treatment plant for that long. So we have these big pressure vessels. We took the media out that we normally use, and we put this special media in called GAC. And we're kind of bottlenecking our flow down through from 3 filters down into one of these special GAC filters. We're actually going to bring 2 more filters in, have 2 GAC filters, and then put that other filter that we took offline and made GAC. We're gonna bring that back and put it into our system as the regular filter again, so. And we're gonna be having a whole new building put in and all that stuff, so. It's definitely for sure.
So even when that's done, are we still gonna have the issue where we have really expensive filters that need to be replaced periodically? Okay.
Yep, and we're gonna have them in Rockland as well. There's gonna be 2 of those in Abington and 4 in Rockland. Yep. It's something that I'm just gonna have to budget for, every year.
Okay.
Yeah. It's expensive.
How long is the loan for?
20 years. So,
How long is this thing supposed to last?
what,
Whatever the new PFAS filters or whatever it is.
how long do those filters, the media last?
No, just like the whole setup, like in 20 years, do we have to do it again? Or in 30 years, do we have to do it
The
again?
useful life of the project is
Yeah.
about 25 years.
So we basically pay off and gotta do it again?
I
So
hope
that
not.
increase,
So I actually-
increase in the
That's
water
the
rate's
useful
here to
life, I'm
stay,
not really
yeah.
sure, like, if that's, how accurate that is, or.
So I actually saw an article recently that there have been breakthroughs in both pulling out and eliminating PFAS.
That's
at-
awesome.
I forget what university it was, but some university.
I'm sure
So
they'll come up with something.
Hopefully, by the time this one's done,
Mm.
there's a permanent solution.
There'll be some, at this point, you take the meteor out, you give it to the company, and they sell it back to you after they like refurbish it, so that's really awesome.
There'll be some relief
Yeah.
after
I hope
the
so.
litigation is complete.
Mhm. Yeah.
I think if we stop putting it into the environment, then it will stop getting into the water.
So that's a huge thing. It's like putting a Band-Aid on a hatchet wound right now. So it's, you still allow some of the things to come in from other countries that aren't being regulated. I don't know that they've actually stopped using PFAS in this country either. I don't know
I
that.
just read, I
It's
just
in- it's in
read it's
all
on your
kinds.
clothes.
Yeah, it's in
all kinds
everything
of
that we use every day.
clothes,
It's even in the air.
Non-stick cookware,
Yeah, so that
Fire-
Band-Aid on a
fire
hatchet wound
prevention.
thing is a good,
That's
foams
true.
are one of the big ones.
We just really need to stop using it, but it's in everything. I mean, you will I hate saying stuff like this because I feel like it scares people, but it's the truth. You probably would get more from eating a bag of popcorn than you will from ever drinking as much water as you drink in your entire life. Like microwave popcorn, it's really bad. I would advise not eating that anymore, if you do.
Wait a minute, are you suggesting that's not really butter? God, I've been lied to.
So, that being said, so that's how I calculate the split. So if you go back to this page that I have, which is the joint budget, this is really the heart and soul, like I said, of the department. To be honest with you, Abington has its own budget, but it pays a portion of this joint budget, and this is, wages and salaries. This is, where the benefits come from. This is, chemical costs. Last year alone, I believe off the top of my head, actually it's right here, we went up $200,000 in chemical costs alone for treatment plants. And we're in this, Eastern Mass Chemical Bid Co-op with a bunch of other towns to try to get those costs down, and we bid them all together, and it's still that high. And that was just using the base that we saw, that we knew was coming in, and then they increase them as they go.
Is it because they,
And like a monopoly?
Monopoly?
Yes, I think so. I mean, I only know of 1 or maybe 2 chlorine gas companies in this area, and I think I got 3 or 4 increase letters last fiscal year. Yeah. I just paid 2 invoices for 2 different treatment plants, and it was $5,000 for 12 tanks each. So it was $10,000. It's a lot. So, yeah. And the laboratory costs, this is just, it's kind of the laboratory cost is gonna be for PFAS and extra testing and things like that. We're going to a new lab in Mansfield that is going to do all of our testing, including the PFAS. It's just gonna be under one umbrella, because I just think it makes more sense that way. They're a bigger lab, they're more accurate, and I like them better, more, so we're gonna go with them. System maintenance is really, your phone bills, your internet, everything. It's your, laboratory supplies. It's a huge line item of just like miscellaneous things like that. And then really everything else is self-explanatory. I didn't really go up on too much besides consulting fees, which will be PFAS and, you know, lawyers and things like that. Yeah. So that's the joint. Does anybody have any questions about that? I know it's not really Abington, but I think it's important that you understand
Good to
what
know
your,
the whole.
that big line item is in the Abington budget. So, that's where the 2.7 comes from, and down at the bottom in green.
And if you
All the way
look
down
over
at the
here,
bottom, it's the,
The Abington portion.
Yeah,
Yeah.
the lab cost though, that, from 23 to 25,
Mm-hmm.
that's like an enormous amount.
from 23, that was the expenditure, to 25, yeah. That was all PFAS.
So from 81 to 130, the extra is the PFAS lab
Yes.
testing?
It's literally $1,100, I think, a test. And we have to test monthly and quarterly, and we were doing pilot study testing and all that at Myers Ave. And then we're gonna have to do it at Hingham Street when we do that, and we're gonna have to do it at Myers Ave when we put those filters online. It's a lot. But you know, this, again, we're an enterprise account, so if we don't use this, it's not,
Yeah,
you know.
It just
I agree.
from that to that is,
It is,
I
yeah.
understand from 24 for the appropriation is 30%, but
Sure.
from there to there, I mean, you're talking 70% more?
And that was all PFAS, for the most part, yeah.
So what accounts for the distinctions and the totals between the joint and the actual department?
So we can go into that now if you wanna.
It's not a big number, but I was just, curious. as to why
So
they're
what
slightly
change,
different.
yeah, what changes go into, Abington? All right, so when you look at the Abington budget, I went up on the details because we were really cutting it close for a few years, and I wasn't 100% sure about the contract for the police department, so all it takes is one or two really good water main breaks, and we're over that. So I just really brought it up $1,500 just to make sure, and that really could be one or two good water main breaks, and that could exhaust that too, so. Luckily, we're a bottom line, you know, budget, but, and that, you know, could be picked up somewhere else, but, I'd rather try to keep it in the line item if possible.
We appreciate that.
Yeah, it kind of hurts my brain when it goes outside that. The postage, I mean, there's obviously a reason why it went up there. We exceeded that almost every year, and postage just kept going up anyways. So then the bottom is the intermunicipal charges, where it went up $136,000 for Abington. And that was just the Abington portion of the joint.
Oh, gotcha, all right, I'm seeing it now, okay, thank you.
Same question, back to this.
Sure.
That one. The consulting fee, did you already talk about them, and maybe I was taking a nap or something?
That's
The
okay.
consulting fees?
I'm looking at.
23 is 22,000, 2025 is 80.
I'm expecting more consulting fees necessary for PFAS with
PFAS.
these, yeah.
So this
and-
PFAS is costing us a lot more money than,
Absolutely.
I'm not saying that you, but
No.
like, not, a lot more money than I think anybody maybe thought it would cost. I thought it was the filters, and then it was kind of like, hey, we're good when we buy the filters. Or whatever, put in the filters, or build this thing.
This is, the
Yeah.
mailers alone are costing us almost $10,000 every single time we send out mailers.
And we don't have any choice to do it electronically.
No, state mandate.
It's the state, and they almost choose every word that we put out there too. So when people call and they're like, I don't understand what this means.
And for all the environmental people, wouldn't that save any, if you didn't have to send these things out?
I would love
No?
it.
All right.
Yeah.
More trash.
Right into the recycling it goes.
I mean,
Back to the Board of Health. But yeah, I would love that, but, you know, this was very new to the, believe it or not, to the DEP when they dropped the regulations, so, I don't think that they realized how much this was gonna affect everybody. I think they thought, and this is just my opinion, but I think they thought it was just gonna be hot spots in the country and like, you know, Air Force bases and things like that. I went up and visited Pease Air Force Base in, New Hampshire, And I mean, you got an Air Force base and then the water treatment plant, and it's so easy for them to just be like, that's the cause, and then they pay up. And they built them a brand-new treatment plant, and it was fantastic. The reason why I went there is because our treatment plant is gonna look pretty much very close to what they're doing. In our case, it's a different situation because we can't really point the finger at someone just yet, you know, so I think we're going after I'm not
Can we
really sure. I
start pointing it at Weymouth? Can we start pointing it at Weymouth? Like we were too
Pointing at
soon?
Boston Weather, too.
Yeah,
All the,
we don't know, yeah.
Yeah, who knows? Bigger fun than
I'll get one of those big foam fingers.
Point right at them.
I won't point it at them until they pay.
Magellan Jet.
I got no PFAS, nothing in Weymouth,
MWRA doesn't have PFAS either.
never landed there, ever.
So, that's essentially, you know, the Abington budget. For revenue, we do have quite a bit of fees and, things like that. I kind of went through and highlighted in a pretty lengthy, write-up all of our fees. So we have, you know, if you put in a development, you get to tap our water main. Depending on the size of the water main, you have to pay a certain fee. If you put in a home, you have to, and you tap our water main, whatever size inch service line you're putting in, you pay a fee for that. There's water mitigation, so, you know, if you add a bedroom to your home, it's $1,100 to do that. That's based on Title V flows. You know, we charge for meter fees if you need a new meter, if you have a damaged meter and it's actually because, you know, you weren't maintaining your home and, you know, it froze and split, we charge for that. Sprinkler charges, that's per square foot, so if you put in a huge sprinkler service, you're gonna pay $1 per square foot. And then you also pay an annual fee as well for that. There is an activation fee for water mains, there's fire flow test fees, there's cross-connection fees for our program. There's all kinds of fees that we bring in. And then, of course, the rate is $8 per 100 cubic feet. And we also charge a $33 minimum dollar charge with a $10 meter charge.
Do you know what MWRA charges per cubic feet?
A lot. I don't know the actual, I bet you I could probably pull it up on my phone right now.
A lot more.
It's a
Yeah,
lot.
no,
It's
I-
extremely
It
expensive.
was kind of a leading question. I'm sure it's a lot more.
It's expensive.
Yeah.
From what I understand. We also do, but I mean, I guess you get what you pay for.
Yeah.
They have great water, and great service, but they also, you know, feed to a huge amount of communities, so I think that that's probably, you know, in order to maintain their system, that's what they have to charge.
But we have great water too.
We do.
Thank you.
I think, you know, a lot of people don't realize, I mean, it's the age of the water mains we're up against. So, replacing water mains is millions of dollars. It's a lot. So, you know, we're gonna work on that. But as far as the regulations go, we do pretty well, except for PFAS. Which was a disappointment, especially coming from treatment. I was very proud coming from treatment and then having that come down. It was, you know, it was awful. Anyways, we offer a $10 senior discount per quarter. You have to be 70 years old. It must be property owner occupied, and there's all different things that they have to come in and fill out a quick piece of paper, but we'll, you know, honor that. And we do bring in fees for liens and late fees and things like that, which I highlighted down the bottom. Any questions? And that, all those fees, you know, go to our reserve and will help fund our articles.
What articles do you have?
I will have a ton. I usually do have, you know, your basic hydrant meters, things like that. I haven't been asked for them just yet, but we're putting together a list. This year is going to be vehicles, they're getting pretty old. So we have some there's some 2009, there's some 2014 vehicles, so we're going to be replacing a few vehicles this year. Conservation, I do have a sick time buyback article I'm going to be putting in, but, for the majority of it, it's going to be, my normal stuff that I always put in. Or that I put in last year, I should say. Let's see, what else? We do have also backflow, sprinkler backflow rates, things like that. And I think that's about it. I know I went over a lot. Is there any other questions?
It's always an education.
It's a lot, I know, but I thought it was important to kind of go over the joint budget in order to have everybody understand fully, like, how we bring in the rates and how we pay pay for things.
And so you have 3 positions that you need to fill right now?
Yep,
And those are already included?
I
in
did
that
include
by-
them, I did budget for them, yep.
Okay.
I am gonna be doing one promotion as well. We usually have 2 chief operators, so we have 3 treatment plants. There's usually 2 chief operators and a primary, and that's required by the state is the primary. But with 3 treatment plants, having 2 chief operators is really necessary. I was a chief operator and they never replaced me, so that's one thing that needs to be brought in. The assistant superintendent, now Tom Royal was the last primary, so we just replaced and promoted somebody for that. We made a promotion recently for a chief operator, and we're gonna be bringing back the second chief operator as well by hopefully the end of next year. Just kind of waiting to
Are you
see.
finding it easier than the rest of us to get quality?
People? No. It is impossible, almost. I mean, the people that we have, I feel very fortunate to have found. I don't know how I found them. You have to have a license, you have to have experience, and it's next to impossible to find that right now in our industry. There's nobody around. And what I'm finding is we're robbing from each other.
Yes.
Big time. So, someone from one department will call and, steal somebody from another department, and it's not anything that we like doing, but I'm not gonna lie, I've done it recently, so. I didn't call them, but they went for the job, so we're all desperate right now. So. But I will say that we're all fully staffed. We're staffed right now with fully licensed people, so that makes me very happy. It's not an easy thing to do, and that's one of the reasons why another part of the benefits part went up, because we do have a lot of junior guys and ladies that are gonna need classes and to keep up their TCHs and things like that, because we have to get CEUs and TCHs, just like nurses do, to keep your license, so.
What's the source for these people? Are they come in as laborers and then they take classes and they move up?
For the
through
street,
organization,
yeah,
or is
for the
there-
street, a lot of times that would be they would come in as a laborer. For a treatment, a lot of times, you could get someone that's majored in bio, and that's easy to convert to somebody, that's a treatment operator. Honestly, a science background is all you really need, and we can kind of make you what we want you to be. I was an environmental science, geography and regional planning major, and then I didn't take water classes, and I just learned myself,
Okay.
so.
Anyone out there who's...
Yes,
Yeah,
we need to
yeah.
find some,
Got an
honestly, the
18-year-old
world is your
ready
oyster.
for
Right.
it.
Anyone listening?
Yeah, it really is.
Anyone listening?
Yeah, you can make a good amount of money in this industry, really you can, with the amount of overtime that a lot of departments are offering, and
demand.
and the rate that we make. The grade 4 operators make almost $36 an hour, so in our department, almost. So it's a good rate.
Anybody else have any other questions? Very good, thanks for
Thank you.
your time.
Thank you very
Thank
much.
you.
Very much.
Waiting.
Oh, absolutely.
Always hard to be the last.
I'm used to it.
Yeah,
No,
you
I'm
should
good.
give her two.
Like I said, I've had so many.
Take two.
Yeah, a lot.
Here so long.
Thank you.
Thanks,
Thank
Crystal.
you.
We're not discussing this, but what is this here that you passed out?
That was part of the one, 5-year plan, that's this year, but there'll be some tweaks to it. But I think it represents about $2 million in project roughly. What we'd like to see something done is, all depends on where we are with free cash. We don't have any anticipation of borrowing for anything this year. So we'll see where we are.
Okay. Cool, very good.
Just don't want us to borrow anymore.
I think, based on financial policies, us doesn't want us to borrow
We're
anymore.
up against it.
At least not a lot.
So next Wednesday, we have a meeting, I believe it's police and assessors. I remember, oh, look at, you got it up already.
Assessor and police.
Then we've got a break over school vacation, Christmas, New Year's, and then we'll likely be back at it in January.
Do we schedule schools yet?
Can you scroll down?
Can I request that the council, do we have the council on aging not get scheduled the week of the 24th?
The request, I think, Chris, I'm guessing you're not gonna be here.
I'm not going to be here the week of the 24th, and the council on aging is
Okay.
somebody that we talk to. Please.
All right. Anything else?
Motion to adjourn?
Second.
Motion's to adjourn, it's been seconded, any further discussion? All those in favor?
Aye.
Any opposed?